If you have diabetes and you see a small wound on your foot, a tiny scrape, a blister, or a cut, do not ignore this video. It might seem like nothing, but for a person with diabetes, this is a critical moment. This is how amputations begin. But why is such a small injury so dangerous? It comes down to a triple threat caused by diabetes. First, there's nerve damage, or neuropathy. High blood sugar can damage the nerves in your feet, which means you might not even feel the cut in the first place. You could walk around for days with an injury, completely unaware. Second, diabetes can cause poor circulation, a condition called peripheral artery disease. Your blood carries oxygen and nutrients that are essential for healing. When blood flow is reduced, your body's natural repair crew can't get to the wound site effectively. This means healing is incredibly slow. And third, high blood sugar weakens your immune system. This makes it much harder for your body to fight off germs. A simple cut becomes an open invitation for bacteria, and with a slow healing process and a weak defense, a minor infection can quickly spiral out of control, turning into a deep, limb-threatening ulcer. In my last video, we explored how these factors can turn small wounds into big, life-altering problems. Today, I'm giving you the essential first aid playbook. This is what you must do immediately if you find a minor wound, providing crucial care in those first hours before you can get to a doctor. Now, a very important disclaimer. This guidance is for minor, superficial wounds only. We are talking about shallow cuts or scrapes that are not deep, not bleeding heavily, and look clean. This advice is not for deep wounds, wounds that are already black, spreading rapidly, or showing clear signs of infection. If you see any pus, experience severe or increasing pain, notice significant swelling or redness spreading from the wound, develop a fever, or detect a bad smell, stop what you are doing and go to the emergency room or your nearest hospital immediately. When in doubt, always seek professional medical help without delay. Okay, let's begin. Step 1. Wash your hands. This is non-negotiable. Before you even think about touching the wound, wash your hands thoroughly with soap and clean, running water for at least 20 seconds. Your hands carry millions of germs, and the last thing you want to do is introduce them to an already vulnerable area. Never, ever touch a diabetic wound with unwashed hands. Step 2. Clean the wound. Gently clean the area using clean, lukewarm running water, or, ideally, a sterile normal saline solution if you have it. The goal here is to flush out any dirt or debris. Let the water or saline flow over the wound for a minute or two. It's crucial that you do not scrub the wound bed. The new tissue forming is incredibly delicate, and scrubbing can cause more damage and delay healing. Just let the gentle stream of liquid do the work. And please, this is critical, remember what not to use. No Dettol, no spirit or rubbing alcohol, no hydrogen peroxide. While these are common household antiseptics, they are far too harsh for a delicate healing wound. They are cytotoxic, meaning they can damage or even kill the healthy new cells your body is trying to build. Using them is counterproductive and can actually make healing take longer. Stick to clean water or saline. Step 3. Dry the area. Once the wound is clean, you need to dry the surrounding skin. Use a fresh, clean piece of sterile gauze or a clean, soft towel that hasn't been used for anything else. Gently pat the skin around the wound dry. Do not rub the wound itself or the area immediately surrounding it. Again, we want to avoid any friction or irritation. A moist environment can encourage bacteria to grow, so getting the surrounding skin dry is an important step before dressing it. Step 4. Cover the wound. Protect the clean wound from the outside world by covering it with a sterile dressing. A non-adherent pad is ideal because it won't stick to the wound bed and cause pain or damage when you change it. Secure the dressing with hypoallergenic tape, which is gentler on the skin than standard medical tape or a bandage. The goal is to create a clean, protected barrier that keeps bacteria out while allowing the wound to heal underneath. Now for another list of things to avoid. Do not apply any traditional remedies. This means no herbs, no coffee grounds, no toothpaste, and certainly no ash or other home mixtures. These substances are not sterile and can introduce dangerous bacteria, cause irritation, or trigger allergic reactions, leading to a much more severe infection. They do more harm than good. What about ointments? Only use an antibiotic ointment if it has been specifically prescribed by your doctor or a healthcare professional for this purpose. If you have a prescribed ointment, apply a thin layer as directed, often to the dressing pad, rather than directly into the wound. Otherwise, the best course of action is to simply keep the wound clean, dry, and covered. Do not use over-the-counter creams without consulting a professional first. Step 5. Offload the pressure. This is one of the most important and often overlooked steps. You must keep pressure off the wounded area. If the wound is on the bottom of your foot, this means limiting your walking. If you must walk, use crutches or a cane to reduce the load. Wear wide, well-padded shoes or sandals that don't rub against the dressing or the wound. Constant pressure on a wound prevents blood flow and crushes the delicate healing tissue, making it impossible for it to repair itself. Elevating your foot on a pillow whenever you are sitting down can also help reduce swelling and improve circulation to the area. Finally, step 6. Monitor and repeat the wound dressing until you see your doctor or nurse. Your job isn't done after the first dressing. You need to change the dressing at least 3 times a week if the wound is clean and dry, or immediately if it gets wet or dirty. Each time you change the dressing, repeat the cleaning process and carefully inspect the wound. Look for signs of healing, like the wound getting smaller or new pink tissue forming. But most importantly, look for signs of trouble. If the wound is not showing any improvement after 48 hours, or if you notice swelling, redness, dark area, increased pain, any smell from the wound, contact your doctor or healthcare professional without further delay. Let's recap those red flags. Stop all home care and go to the hospital immediately if you notice any of the following: increasing pain, throbbing, or new tenderness. Spreading swelling or redness around the wound. Any pus, discharge, or a bad smell coming from the area. If you develop a fever or feel generally unwell. And critically, if you see any black or dark, discolored skin forming around the wound. This is a sign of tissue death and is a medical emergency. Proper foot care is a cornerstone of managing diabetes. Having diabetes does not mean you are destined to lose a foot, but ignoring a small wound can lead you down that path. Knowledge and immediate action are your most powerful tools. Please share this video with a friend, a family member, or anyone you know who is living with diabetes. Your simple act of sharing could save a foot, or even a life.